All right. Thank you very much for the introduction. If I may have the presenter right, so I can move the slides. There we go. Thank you. Good morning. Welcome to the second webinar of the thematic network of On One Health, Peitho. In this webinar, we are going to look at the One Health research. We're going to have really a glimpse into the European One Health research and innovation, and also we're going to discuss about how to put the One Health outcomes, then how to apply this One Health outcomes in the real world. We are going to have a couple of keynote presentations. But before we go to our to the presentations, just a couple of words of introduction about Peitho and about the health policy platform. This is just in case you were not here at our first webinar. Peitho is a thematic network on One Health in the frame of the EU health policy platform. The EU health policy platform is a tool of the Commission, but Peitho is indeed managed by the European Health Association. We started our work early this year, and we are going to work until September 2026. In fact, these thematic networks have a beginning and an end. The aim of Peitho is to strengthen the transdisciplinary, interdisciplinary, and cross-sectoral approach to One Health challenges in Europe, with the ultimate goal to support the operationalization and possibly institutionalization of sustainable One Health solutions. What does it mean practically? I will tell you in a minute. The format of Peitho is the virtual space kindly provided by us by the EU health policy platform, as well as the webinars. The webinars are indeed a central tool with which we gather information. Please feel encouraged to join Peitho in case you have not done it yet. Throughout the presentation, throughout the introductory presentation, you will see the QR code and the link to join Peitho on the left side of your screen. So please feel free. The final output of Peitho is a joint statement. Now, just a couple of words on what is this joint statement, of what is its target. The target of the joint statement are the stakeholders relevant to One Health in Europe. What does it mean? Who are the stakeholders? Well, that is us. Research performing organization, reference laboratories, institute with official tasks, but also NGO, the private sector, professional associations, and so on. So the joint statement will really be a document by the stakeholders for the stakeholders. This is not another position paper. So it's going to be something practical. Possibly this could have usefulness also for the makers of policies, the makers of decision. Indeed, if a policymaker would take a look, would read the joint statement, they would find, they would understand what is going on in the field in regarding One Health in Europe, what is the plan for One Health in Europe. Therefore, they could set up the best tool to support us, and I mean also funding tools. Therefore, the joint statement is very much a bottom-up initiative, which also kind of support top-down initiatives. All right, so let's take a look very quickly at this joint statement. This joint statement is structured into these three pillars. Each of this pillar is the center of one webinar, and the solutions that we are going to gather in these webinars are going to give advices on how to practically put into use the recommendation by the that were given by the scientific advisory mechanism in the well-known document One Health Governance in the EU. What does it mean? The scientific advisory mechanism set out 6 recommendations, if I'm not mistaken, but these recommendations are more strategic, a little generic. We would like to give really practical advices for the stakeholders on how to follow them. That's the main idea. Each pillar will address some of these recommendations. Each pillar is one webinar. We had our first webinar on One Health networks on the 28th of April. The material of this webinar is available online on our platform. So again, another reason to join Peitho. The second pillar is on One Health research and innovation. That's today, what we're going to discuss today. And then the third one is the 10th of June on the operationalization of One Health solution. And we are going also to talk a little bit about the governance. All right, before we jump to the our keynotes, I would like to briefly give the floor to the Vice President of the European One Health Association, Hein Imberechts, who is going to give you a quick overview on the funding programs available right now in Europe. Hein, the floor is yours.
Thank you, Ludo, very kind of you. Yes, indeed, if you're talking about research, we also need to talk about budgets, and maybe it's useful to show a few slides to highlight what is going on now and what may be expected in the future. So you are all aware that there are two main routes of funding for the moment on the Commission. One is Horizon Europe, which is DG Research and Innovation. The different partnerships are funded through this channel, and there is also EU for Health, which is budgets coming from DG Santé. And so there are two different levels. Next slide, please. And this is the actual situation, like in Horizon Europe, where you in the middle, you may be familiar with this, in the middle you see there the second pillar, and you see different clusters where health is in one cluster, and public health is that, and agriculture, animal health, for instance, animal welfare, is in the cluster 6. So here in two different clusters for financing of the pillar 2. Next slide, please. You see that the different partnerships that are funded by Horizon Europe, so DG Research, there are, I think, more than 40. They are depicted there in different colors with different funding schemes. And on the right-hand side, you see that there are a number of partnerships that have something to do with One Health. They have One Health components within their remit. For instance, Be Ready, for instance, One Health AMR, Cluster 1, the Partnership Animal Health and Welfare, which is in Cluster 6, and vice versa. So there are a number of these partnerships that are dealing with One Health or with the One Health approach, but that are either in Cluster 1 or Cluster 6. Next slide. Then we have the EU for Health program, which has a lower budget, which focuses on preparedness, prevention, health systems, and which is being created after the COVID crisis. So there are two different streams, and on the next slide you will see that the same thing in a schematic form. On the left-hand side, the public health cluster 1, or the project that are really dealing with public health. On the right-hand side, animal, food, environment project. On the right-hand side, mainly partnerships. And there are so different streams, funding streams, and the One Health, European One Health Association wants to bring together, wants to create some initiatives that brings these different consortia together, all those that are working with One Health. So if it is possible to align their approaches, to understand how the different consortia are interpreting or going on with their definition of One Health. So that's something that the association is doing. Next slide. And that is the future. Whereas I told you that in the current funding scheme, there were these two, Cluster 1 and Cluster 6. What is known for the moment is for the FP10, so from 2028 to 2034, there would be only one funding available for both public health and for agriculture and bioeconomics and so on. So this may represent, so it may be some opportunities, it may be a threat. That's something we don't know for the moment, but nevertheless, there will be only one funding for both public health and animal health and the environment. So that will be the challenge for the future. I think I'll stop here, Ludo. It's just to briefly say where the funding may come from in the future. Thank you very much.
Thank you, Hein. Indeed, also something to keep in mind. Where does it come now? Where will it come in the future? Maybe a possibility for the framework program 10 for One Health. All right, so I'll feel free to take the floor and then to finally introduce you the agenda of today. We're going to talk about One Health research collaboration in Europe. First, we're going to have an example indeed of a European partnership, the Partnership for Pandemic Preparedness, Be Ready. Then, after a discussion, we are going to move and see how the research and innovation solutions, the One Health solutions developed by the research consortia, are then put into use. And here we are going to have the example of a simulation exercise on avian influenza performed by the Belgian colleagues at Sciensano. All right, and now I would like to introduce our first keynote, Natalia Martin, who is going to talk about the Be Ready partnership. A word of introduction, Natalia is head of the European Affairs and the Be Ready coordination team at the French research agency ANERS, Emerging Infectious Diseases. She worked for many years as a scientist in a high-level research institution, for example, the Institut Pasteur, the NIH, INSERM, and then she moves from the lab to the strategic roles in European and international affairs in major French research organization and also funding agencies. At ANERS MIE, her team plays a key role in cooperation on pandemic preparedness through the, indeed, coordination of the Be Ready partnership. All right, Natalia, the floor is yours.
Thank you. Thank you very much. I hope you can hear me well. I'm here with my head deputy, Laurent, and he's going to present the first slides. He is the one who has been key in the role of preparing this partnership. I joined the agency only a few months ago to build the team dedicated to the coordination. So the floor is to Laurent, and then I will take the lead. He's next to me.
Thank you very much, Natalia. Good morning to everyone, and thank you for the opportunity to participate to this meeting. I'm trying to share the document. So can you see the document on?
Yes.
Yes. So yes, thanks a lot. The Be Ready partnership was just launched in January this year. So thanks again for the invitation today, because it's a very important opportunity for us to present this partnership and to engage with the community, the One Health community you are an important part of. The Be Ready partnership so began this year, but it's been prepared since 2021. Further to the previous infectious disease, of course, COVID-19, but also before, they highlighted an important lack of preparedness at the European level, the fragmentation of the research landscape and within the different members of the ecosystem, and the need for more coordination at the European level. So that's at this stage that member states and the European Commission decided to prepare and establish a future European partnership for pandemic preparedness. What is a European co-funded partnership or a partnership, European partnership? So it is for pandemic preparedness. It is one part of the response that the European Commission and the member states decided at that time. Several new regulations, instruments, DGs were created to reinforce the European health security framework. And the Be Ready partnership is really the part dedicated to the research and innovation for pandemic preparedness and response. So the advantage of European co-funded partnership is really to gather both the funding, I would say, from the different national agencies, national ministries of the European member states and associated countries, and also the capacities, meaning all the members of the ecosystem in each national level, to participate in a joint endeavor and around shared priorities in order to concentrate and focus all the efforts, fundings, capacities around shared goals, both in preparedness, of course, and also at the time of an outbreak. So this partnership is really a collaborative platform for countries and is structured as a large-scale 7-year European initiative with the ambition to evolve into a sustainable platform beyond EU funding. So for now, the partnership is co-funded for first phase of 3 years, 2026 to 2028, with a first budget of 117 million, provided half by member states and the European Commission. And the second phase is being prepared for the next 4 years, 2029 to 2032. Currently, the partnership is an important, has an important implementation part with 18 work packages, 81 partners, 110 deliverables, who's currently participating in the partnership. So further to an important 3-year preparation phase, we've been here at the NRS in CERN, who is coordinating the partnership in contact with the different member states, associated countries to Horizon Europe, engaging to present the approach, the objectives, to design and define them together with several countries. So for now, 21 on the 27 member states of European countries are participating, actively participating into the partnership. 6 associated countries to Horizon Europe decided also to join the partnership. And we would really like to insist on the openness and transparency of the partnership. So since the signature of the grant agreement and the beginning of the partnership, new countries are already in contact and interested in joining. So that's an important way, and we will really remain open to be as inclusive as possible, because pandemic preparedness is really the cross-border health threats that we need to tackle. And for now, 81 organizations are participating inside, and it's really, they are reflecting the objectives of our partnership. So they gather public health authorities, so Ministry of Health, for example, ministries of research, of course, research funding organizations, public health institutes, etc. So all the capacities and also infrastructures, members of the ecosystem that are needed in pandemic preparedness. The vision of the partnership is really in relation with its scope. So really the research and innovation part for pandemic preparedness, other institutions at the European level, such as the different DGs, but also the CDC, the EMA, the DG HERA, the GRTD, DG Santé are very much involved also. And the partnership is really focusing on this part on research and innovation. So what are the different, how is it organized, I would say, to achieve the outcomes that we've decided together? The first pillar around aligning research, really the previous crisis highlighted the fragmentation. So the objective there is to define together joint priorities on the medium to long term, and also to be in position to update them regularly, and also to be able to define research priorities at the time of a crisis, such as recently with the Andes virus crisis, but also previously on Mpox or H5N1. The objective is really to have the capacity to consolidate a scientific assessment at the European level with all the member states involved. The second activity plan is boosting research. So this is really important activities that is funding research through joint transnational calls. A third that will be presented more in detail, all this pillar by Natalia, so I go quite fast. The third pillar is about supporting and connecting the research ecosystem readiness through a support to, and it's covering both basic, preclinical and clinical public health and implementation research. And the fourth pillar focusing on the different research and innovation skills that are needed to perform the other activities. So now I give the floor to Natalia.
Thank you, Laurent. So good morning again, everybody. So I will go into detail in some aspects of the work we are performing since January this year, and related to One Health, of course. So first of all, the Strategic Research and Innovation Agenda. This is a document that we are all familiar with. There is already the first version published on the website, so you can scan the QR code there. if you want to have access to the document. This was prepared during the preparatory phase of the partnership, and it will be updated from next year. So instead, this document represents the strategic guidance for all the partners. It has been built through a collaborative work of all partners, but also external consultations. And it provides an integrated vision with all the critical research areas for pandemic response. There are three main axes that then are with different activities. The axes are mostly understand and prepare. This is about increasing scientific knowledge on pandemic preparedness. And one very important tool is the joint transnational calls that we organize every year. So, and I will go a little bit into detail because there's a call right now under preparation with a One Health focus. Then the second pillar is about preventing and anticipating infrastructures, processes, and workflows. And then the third one is to respond and control in the time of a crisis. So we as was mentioned by Laurent, we work, most of our working is about how to prepare and these famous ever warm networks always ready in case of an emergency to react. And then there's the work that we perform in case of a crisis. And the hantavirus outbreak has provided a very good example, and I have a couple of slides to show you. So in the next slide, I go into the fact that the One Health approach is embedded in this scientific strategy, because many emerging diseases are zoonotic. The One Health component is needed. It is the most prominent place in our SRIA is in the priority one, the one about accelerating knowledge in a coordinated and integrative manner with two actions. The first, the action 1.3 with environmental and social aspects driving pathogen emergence, and the action 1.4 for the transmission dynamics and epidemiology. In the priority 3 that I show you on education, training, and communicate with One Health literacy, One Health is also very prominent. So let's go to the next slide. You will see this joint transnational calls. So as it was mentioned, the partnership started in January this year, a few months ago. And from the very beginning, we launched the first call in 2026 that is under evaluation right now. So the focus of this call is host pathogen dynamics. So it is not directly targeting One Health, but many viral families addressed are zoonotic, creating a natural entry point for cross-sectoral research and allowing for direct application in other fields of research. Now we are currently preparing the next call that will be launched at the end of the year. And this is not the right slides, but what I would like to mention is that this joint transnational call is under preparation. Nothing has been decided yet, but we are right now discussing about addressing explicitly a One Health approach. So regarding the actions that I already showed you on this RIA, because the joint transnational calls, I didn't mention it, but the joint transnational calls will be based in the priorities that have been identified in the strategic agenda, with ecology, animal health, and human health expertise that most probably will be present in the proposal. So we encourage each transnational call to combine at least 2-3 different areas of expertise to avoid single sector proposals. So next slide. So the One Health approach is illustrated here in all our calls or our activities. We address in all the calls, or we're planning to address human health with clinical, epidemiological, and public health needs, animal health. But in animal health, we are not addressing specifically animal health research, but more the spillover mechanisms and reservoir interfaces. Of course, we are addressing ecology and climate. What are the environmental drivers of emergence of viral outbreaks, and social science on behavior, risk perception, and implementation. So the expected outcomes for all the calls is to better understand the emergence of new zoonotic diseases, transmission and intervention points, and proposals designed around real-world interfaces. So other activities, I'll speed up a little bit. Other activities involved in One Health approach are in the Work Package 13 that address capacity building activities and knowledge sharing. And there is a dedicated integration work stream in Work Package 18 addressing One Health approaches in global health and planetary health. So maybe next slide to show you one example, and I will finish with that, one example of real life. So as you all are aware, Andes hantavirus, there was an outbreak very recently with patients and contacts in Europe. So we were activated, Be Ready was activated, this time not in preparedness, but to respond to a real outbreak. And among many things that we did is in the past days is that we defined what are the research priorities that are needed to address the current situation. And the One Health approach, this is the overview of the strategy or the priorities that we put in place that have not been completed, but it's sure that for addressing from the research point of view this particular outbreak, we need to go into better understanding the animal reservoirs, better understanding also how the zoonotic transmission has happened and how this particular outbreak is transmitted from human to human. As you know, this is very rare in hantavirus. The clinical evidence, of course, natural history, severity of the disease. Another research need is about tools and care with diagnostics, antivirals developments, immunotherapy and vaccine, and finally the societal response. So as you see, this One Health approach is also identified in the case of a real-life outbreak that we are all living. And to finish my presentation, this is one particular, the particular priority that we have identified in the hantavirus outbreak with a very focus on One Health approach. I will stop there. I think our time has run, and if you have any questions, we can go instead to further explain things. Thank you very much.
Thank you very much, Laurent and Natalia. At this moment, I would encourage the participant to ask any question. You can use the chat or you can raise your hand and then we will give you the floor. I know that, sorry? Okay. I know that in the when we're having a web meeting, it takes a while to formulate the question, maybe through the chat or through raising the hands. So if I may, I would actually start with one question that came into my mind while you were presenting, and well, I think it makes a lot. I mean, of course, it makes a lot of sense to incorporate the One Health approach when dealing with the zoonosis, for example, with emerging threats. But this is also very ambitious, and I was wondering whether in your consortium of 80 institutions, if I'm not mistaken, 81 institutions, you have also organizations that are very strong in One Health, that have a strong experience in One Health, or if this is mostly public health institutions.
Yes, thank you, Ludovico, very much for your question. Yeah, we really have embedded since the beginning important institutions in member states and the European level that are day-to-day working on the One Health approach and are promoting this approach. For example, I'm thinking about the AGES Austrian agency or the ANSES in France, but also, for example, ZONMW, the Dutch entity that funds and coordinates One Health and planetary research, and is a key contributor of the One Health partnership. I'm also thinking about the State and Serum Institute in Denmark. So all these important stakeholders have been involved since the preparation phase of the partnership, and they play an active role as work package leader. For example, Natalia was mentioning the work package 13 on capacity building and training, but also the work package 18, which is specifically dedicated to the integration of the One Health approach into the partnership. And they are also all involved in the work package dedicated to alignment of research priorities to make sure that the One Health is really mainstream, I would say, into our strategy.
Okay, thank you. So it's really the One Health approach really is there from the beginning, as I understand that, also in the overarching work package. Wonderful to hear. Anouk, do we have any question or any hand raised from our attendees?
Yes, there are several questions in the chat. So the first one is, thank you very much for the interesting presentation. Are you now publishing the calls to answer the identified questions on this virus outbreak, or are you conducting the research yourself?
Yes, I can answer to this, both. So right now we are mapping, we are trying to map all the research priorities in all the countries to identify convergence or discrepancy in the priorities, and we are also mapping the funding that each country is planning to launch to address research needs. In Be Ready, we can also, there are many things. We can use this information to inform the European Commission on what the countries are planning to fund, what is needed at the transnational level. EC can decide to include a call in the EC calls that were presented previously. And Be Ready can also jointly have the capacity to launch a joint transnational call if we consider it's necessary to respond to this particular crisis or any other crisis. And then we have also in-house research activities. And indeed, to answer the question, indeed, we have been mobilized since the patients and contact repatriation to their countries. I think it was on May 10th, on a Sunday, that very same day, we had a meeting at Be Ready with European Commission, ECDC, EMA, and we have been having meetings since then with the WHO also, and Be Ready has been requested to coordinate a study from the WHO, and that is already running to study the natural history of the disease. So both we can, our partners are launching calls, we are mapping this, we don't know already. We are trying to identify convergence and divergence, and there is in-house research activities in this particular case on the natural history of the disease, because this was what was decided to be the most immediate need to address this particular outbreak.
Okay. Well, thank you very much. I mean, I think this is a very, crucial also to avoid the overlap in the whole research arena in Europe. Thank you. Anouk, do we have any other comments, other questions?
Yes, another one is a partnership a good means to react to a health crisis? And what kind of instruments would facilitate such reactiveness?
I think I already answered to this with the example of the hantavirus, maybe. I must say that we used this, we started in January, so only a few months ago, and we used this outbreak to assess if we had put in place the right mechanism to respond rapidly and in a coherent mean. And indeed, Ludovic, this partnership, it was this particular instrument, the co-funded partnership, is an instrument that allows all these representatives of all the countries to work together, aligning and synergies and avoiding duplication of efforts, as it happened in past crises. For example, for COVID, many countries were launching in parallel the same calls, the same funding, and this is what we want to avoid with this particular instrument of the European Commission, where member states and European Commission work together towards a common agenda.
Indeed.
A final is a more practical question about the call for 2027, if there already is an expected timeline.
2027, it will be most probably launched at the end of the year in December or beginning of next year. And as I mentioned, right now discussions are under these particular priorities of the strategic and research agenda, but it's not sure.
Okay. And we're talking about the call where you would encourage different sectors to be on board. I have seen from your slide even the environmental, social science, animal health sectors.
Yeah, if you
That
go
would be wonderful.
I invite everybody to take a look at the agenda and see the actions, I think 1.1 and 1.3. Right now, the discussions are around these particular actions in the strategic agenda.
Yeah, and to check, I guess, your website regularly for the opening of the call.
Yes.
Well, actually, sorry, Anouk, anything else in the chat, or maybe there is some hand up? Somebody would like to take this?
No. No.
Well, I would have one additional question. I mean, this is kind of a long shot, but what happens then after 2032? You have set up all this beautiful consortium, so many organizations on board. Any plan for sustainability? I know that it's very early to talk. I mean, you just started, but just to have an idea of the future.
Oh, thanks a lot, Ludovico, for your question. I think it's an important one. I think this is also about pandemic preparedness, but more generally, this also covers the discussions around the multi-annual financial framework, etc., that are ongoing on the different tools that will be in place after the adoption of the next multi-annual budget for the European Union. So there, the partnership is running for 10 years. And then since the beginning, we are, since now, to be honest, already taking the phasing out strategy or the sustainability strategy after the end of the EC funding that is planned so for 10 years. So it is taken into account. I think it comes into also wider reflection on the resilience at the EU level and the state of preparedness. So I think it will evolve in the next years, in the next thinkings and reflections. But there is also another point that is on its way, is the reflection on the balance, on the difference between the cost of inaction, for example, of not investing in our collective preparedness, how much does it cost, versus the cost of a pandemic outbreak or a pandemic such as the COVID. So there are already national funding institutions in different member states that are preparing some, I would say, scientific papers or reflections on that, and that helps to feed in the reflection. So we are, as we mentioned with Natalia, just starting in January, but yes, we are already trying to shape and to build also based on the lessons learned of the implementation on what could be the partnership after this first 10 years endeavor.
Yeah. Indeed, thank you very much for the reply. Thank you very much for bringing this up as well. the cost benefit calculation. Should we use that one? Should we use more a return of investment, so purely economic reflections? I mean, this is also an important point that would need additional.
Sorry, yes, Ludovico, just to complete on that, because also
sure.
it's of course an economic figures that we want to I would say to provide figures, but it is also on society, on values, on what we want together for our society. Because when you touch to health, yeah, economy is important, but it's not the only one. I would say thing to take into consideration. But just to mention that we take all this into consideration. Thanks a lot.
Absolutely, cost benefit, not just the return of investment. I mean, there are some things that are hard to put into economic terms. Thank you very much once again to both of you. And I think at this moment we could go on with our second keynote. Please feel free to stay until the end of the webinar, of course. Our second keynote for today is going to be Geraldine Bossert. Geraldine is and she's going to tell us something about the simulation exercise on avian influenza in Belgium and how to put really the One Health solutions into practice. Geraldine is a veterinarian specialized in epidemiology of zoonosis and emerging diseases. She's working as a crisis coordinator at the Crisis Preparedness and Response Service at the Belgian Public Health Institute, Sciensano. And I learned that she also holds a number of positions at the University of Namur and the University of Liège in Belgium, of course. Well, really looking forward to learning more about the simulation exercise. Geraldine, the floor is yours.
Thank you very much, Ludo. So I'll share my screen. Up. Here is it. Do you see it?
Yes, clear.
Nice. So thank you for the nice introduction. I'd say that first, also my colleague Jürgen Stassains is among us to complete on question I would forget or to add more information on some specific topics. And second, that here we are more talking about operationalization of some, I'd say, initiatives on the field. So this is less research than active taking of the things among actors in the Belgian network. So this presentation will be in three parts. First, a couple of words about avian influenza and the specific situation in Belgium. Then description of three actual simulation exercises in the same story. And then a couple of action points that are on the way and that we wish to have successful. So as this was already said in the previous presentation, avian influenza, highly pathogenic avian influenza is a worldwide concern. We call it even sometimes the next pandemic. And why is that? Because the influenza viruses, and avian influenza is not forgotten, has a very broad history of mutation. Remember the precedent big outbreaks of influenza in humans, so the Spanish flu, the Asian flu, etc. Avian strains were involved in the remanipulation of the virus and made them more prone to infect the human host. You see here the specific situation of a very close story from us, I'd say in the United States, with the genotype B313, where there was a recombination of one strain of avian influenza H5N1 coming from Europe and an American lineage who make this specific strain more prone to infect humans. But it's a fact that interspecies spread of avian influenza to mammals is not a recent story. That's old story actually. And you see here in the map that a broad range of mammals have been already notified as infected by avian influenza and showing or not clinical symptoms and with death at the end of the disease. More close to us is the infection, the potential role of hosts of cats, domestic cats, in the spread of avian influenza. We've seen that in the Netherlands in November 2025, but also in Belgium, were cats. In both cases, cats were living in farm close to poultry, and there was an outbreak in avian influenza in those poultry farms. And cats, at least in Belgium, were infected, showing clinical signs, and died. That was analyzed by our national reference lab, and that was positive for avian influenza. Moreover, specific genetic markers of adaptation to mammalians have been identified by our lab. That was, if my memory is good, the BP2657, something like that, with one of the most known mutation in the genome, giving the capacity to virus to adapt to mammals. Let's talk to humans then. I think already still in mind the infection, the big outbreaks of avian influenza in the USA, with transmission to cow and then to human. What it was noted, this was around 66 confirmed cases, but updates showed that it was 70 cases, among them 1 death. And this is not a lone story. Other cases have been identified worldwide, as you see here, even in Europe. But fortunately, we are still a little spared comparing to the other continents. So, preparedness and response. Since the COVID outbreak, epidemic, this is a big concern, both in national and international points. So European Union is preparing, who is preparing, and what is now said, that's we are not waiting for a pandemic, but for the next pandemic. So be prepared. Are we prepared for the next pandemic? And you see here the cycle of the crisis, and with the blue circle is the peacetime, where you would identify the risk, train them, etc. And then if we have an incident, we could come into the orange zone, which is the crisis zone. And simulation exercise have a big place in the peace phase. Of course, we would prepare in peace phase to be ready to control, to respond in crisis phase. That's what we will be talking about during this seminar. What about Belgium? So you would better talk about something you know. But Belgium is quite really difficult to understand, as this is illustrated here by one of our famous humorists. And actually, in terms of competence in the 3 big sectors, which is human here in red, animal here in blue, and environment here in green, you see that a couple of years ago, the competences were completely divided. They were working in silo with interconnection really difficult to put forward. And moreover, more difficult was the fact that some competences, for example, food, livestock, cows, poultry, etc., and occupational work were dealt at a national level while environments, domestic animals, etc., and citizens were dealt at a regional level. In Belgium, we have 4 regions. That's Flanders, Dutch-speaking, Wallonia, French-speaking, Brussels, everything-speaking, and now German-speaking community. That's the 4th one, the new one. So we have to include all these kind of national competent authority into the working. Not really easy. That's where we tried to put all these people together, and this was the prequel of the simulation exercises that I will present to you, and make these people see where were the connection, especially regarding avian influenza with 6 different cases with wildlife infected, poultry, domestic pets, livestock, patients, and workers in close contacts with infected animals. See here the map. This is actually an interactive map where you can click on the forms and the arrow to have information of the people involved in the different crises. And you see here that this is more interconnected than this was before. That's a good, beautiful step. Second is that we included in this network all the risk advising bodies and the risk management group. These were very separated. I'll show you in next slide. But there is now a will to make them interact together in a kind of zoonotic context. And last initiative, there are other initiatives, but this one is also a very interesting one, is the ZooWIS project. ZooWIS for zoonotic influenza surveillance is a project aiming to detect, to have surveillance component at the human-animal interface. And this is divided into two different types of cohorts. First is the sentinel cohort, where workers like veterinarian in pig or poultry industry, workers in wildlife rehabilitation centers would agree, that's always on voluntary basis, would agree to self-swab every 2 weeks. And then we have kind of image of the situation for these specific people close to potentially infected animals. Second component is the outbreak component, where we have an outbreak in mostly poultry. People in contact with infected animals, I mean by that farmers, family of the farmers, technicians, veterinarians, controllers, would agree to be self-swabbed every 2 days and to allow blood samples to see if there would be a seroconversion, something like that. For the time being, no positive case. We are still crossing fingers. But this initiative is growing very positively. First, it was financed by the Flemish region. Now the fourth region are taking part of the project. And this is a very good initiative with gathering a lot of positive advices and reactions. What has been added to this ZooWIS project is the cat shelters, as cat is a very important element to have in the network, and also every biosecurity protocols. So then, and people are aware and informed that when they have symptoms, they would call our services to have this integration into the ZooWIS project, or to be integrated in a surveillance system to see whether they would be infected or not by avian influenza infected animals. The second point I pointed before with the ZIN map was the aspect of risk analysis. Before, that was quite separated, with the risk assessment group and then the risk management group were only devoted to public health. On another side, following the COVID situation, COVID crisis, veterinary emerging zoonosis risk assessment group was created, the RAGVES, so it was the risk assessment group and then the RAGVES, and aiming to have more expertise on animal health and wildlife. And for public health, first, the RAG, Risk Assessment Group, was responding to the Risk Management Group. But now, what we aim to do, and this is now written in convention with all the stakeholders, is to have an extended Risk Assessment Group, RAGVES and RAGBROC together, and an extended Risk Management Group to deal all the zoonotic potential situation. Yeah. So, that is the situation in the world and mostly in Belgium. And now how to actively verify that all we have put in place in a theoretical way would work. The best is to let people play together, to have simulation exercise. And we get the first prequel, as I said before. That was an exercise where we put together the 10 agencies involved in the ZIN network, the Zoonotic Influenza Network, in a CIMEX with the scenario with infected people, and action points were created. That's when the ZIN network was created, the proposition to have this RMG extended group to be put in the legislation, and that was a way also to begin to write what would be avian influenza outbreak protocol. That was the prequel. Then we began the story. The first exercise of the whole story of 3 different exercises was done internally. You would begin with small initiative and then we will grow. That was the objective here. And this exercise was tabletop, was aimed to test procedures. That was the duration of half a day. And the people who were involved in this exercise were services of Sciensano. That was completely internal drill aimed to see if Sciensano is ready before coming into a broader story. You had there the National Reference Lab, NRL, for avian influenza, the National Reference Center, NRC, for human respiratory diseases, and the dispatching. This is the service almost forgotten. But without a dispatching and a sample management system, you won't get the samples, and you won't have the information regarding the surveillance and the reaction when there is a positive case. The coordinators, so the people who would put the inject, were ourselves, so the CPR service, but also the communication service, who played different actors coming from the outside. The exercise was called Wilbur flu. Actually, during the writing of the scenario, we planned to put a cat into the story. Then we changed to a parrot. And Wilbur is the name of the cat of the first prime minister, the prime minister of England. So hence Wilbur flu. The scenario has a length duration of 3 days. And really the objective was to test how these different services would act together with really operational issues, like the people who are bringing the samples to the institute would be blocked into an accident in the circulation, or whether the concierge would be blocked in at the seaside because of a strike of the train, etc., etc. And what I can say is that here they succeeded in these difficult tasks to organize themselves, to deal the situation. They succeeded. That was very nice. At the end of the exercise, you see that in the timeline here, we involved external actors. So communication service did that a very nice way with journalists, eager journalists to know the situation, what's going on, etc. And also people from other institutes out of our institute to say, what's the situation? The end of the story was first infected human. We just did know that there was a guy that was the owner of the parrot who has clinical symptoms and was positive for avian influenza. A couple of pictures. That was, you see here, tabletop in a small team. People were solicited, injected through their computer, the specific computer with WebEx messages, and injects were done from real existing documents. Like you see here this result of a real-time PCR. That was a press communication was created, invented, but coming from, we used templates were already known by the people with un détournement, another name, other information to make it like an exercise tool. Also SMS messages, etc. So quite close to the reality. Second story. The second episode was an interagency simulation exercise, gathering the same people done during the prequel, so the 10 agencies. It was called Zai Zai for zoonotic avian influenza, twice because that's a song in a French-speaking community. That was also a tabletop format with a little innovation is that we use, you can see here in the picture, a small closed network. In the center of the table, you see that was the server, and this computer was connecting all the 11 computers all together to allow them to exchange information, PDF, images, pictures, etc., but no access to the outside. So no access to internet, no access to their own agencies, etc. That was in closed network to allow to enhance the possibility of exchanges between people. The coordinators were us, the CPR service of Sciensano. And so the whole Z network was involved in that exercise. We're among 38 participants, so that was quite big, but it went very well. Here, the scenario was lasting longer. That was 12 days, starting at the winter seasonal flu. And then here, the cat was present. And the origin of the infection was a dead weasel found sick. It was not yet dead, and put in a family along with other cats. So the dead weasel infected the cats. The dead weasel was put in a rehabilitation center while the cats were spread in Belgium among different families for adoptions. And then, of course, we made the scenario going worse and worse and worse with one worker who was sick, then confirmation that the cat was positive for avian influenza, as well as the weasel. Then a second people who was sick and then confirmed positive for avian influenza, and then people from the family, etc., until the end where we had the first dead human. So that's new in the Belgian story. And the objective here was to put everyone together to prepare the possibility that we would have a positive case. Then that was the case at the middle of the exercise. And then how to deal with this disease if this is deadly. And during this exercise, the RAG, so the risk assessment groups from both human and veterinary sides were working together, as well as the risk management groups who made a meeting together to discuss how to deal with the situation. So the exercise was divided into 2 days. First, that was the actual simulation exercise where people were injected with different situations and events, and they had to work together. And the second day, that was the debriefing, where we reviewed together the scenario of the story, put where the weak point, the strong points, etc., the reactions, and action plan was decided with all the people all together, and they would validate this action plan that would be tested in 18 months in another CIMEX. Then we come to the third episode. That was, we're coming from internal, then interagencies, and now we are at the national level. And that's more that involving all the regions of Belgium, that's involving all the federal institutions, the federal ministries, etc. of Belgium. That's federal crisis level. This was not organized by us, Sciensano, that was done by the NCCN, which is the National Crisis Center. Duration was only 1 day, and that was a command post of command exercise where different cells has to be, and I have the illustration here, has to do their work in their own place, but interact and exchange the information in order to try to manage the crisis. We, Sciensano, were mostly involved in the evaluation cell on the left, and this evaluation cell has to provide advice to the management cell, I would say, the Federal Coordination Committee, who would provide information to the ministries. That is here written the belate cell, that's the decision deciding cell. And that was, let me go forward, that was tested, so that was only 1 day. So what would we do during this single day? That was 19th of May. Injects were coming during the whole day. That was a total of 11 injects, if my memory is good. And everyone has to react following the update of the situation. We came from no infected at all, one positive case, to several clusters in the whole Belgium, and then the first dead, and then a second dead, and then hospitals who were solicited to have the suspicion, etc., etc. And what would we do in a federal point of view with involvement of Ministry of Economy, Ministry of Mobility, even the Army, etc., etc. That was a quite very nice story. It was not too catastrophic as we had only 11 human deaths. But if you have been continuing to follow the scenario, that would be broader. And a couple of photos here. You see that's the COFECO, so the Federal Coordination Committee, who was taking advice from the Evaluation Committee and then advising the ministry. See here, that's the command post, the actual real room where crises are dealt. Here you have the connection with the cats and the different members of the family of the scenario. That was quite nice to imagine. And an example of the kind of injects people get. That was some raw data, even with also cards, etc., etc. So in a way to make that as real as possible. And so here, that's the end of this 3-episode story, end of the season. We may have a 4th episode coming in the coming months. But what we succeeded in develop here was mostly action points. Important to mention is that as the federal exercise just took place 2 weeks ago, we still are in discussion for all these action points. But for the internal CIMEX and for the Z network CIMEX, action plans are ready. And we have already dates to try to drill, to test, to put everyone together to see if the way of functioning is still as good as it was during the exercise. But even what was really, really, really nice in that kind of story is that people learn to see other people face to face in presential and to deal with them, to talk with them, to interact. We, for example, have this notion that the German-speaking community, who is very new in the network, was a bit forgotten. And we involve them with us, and they say, "Okay, we can add that, and we have this expertise." And that was quite rich because we have to put everyone in the same boat to make the trip successful. So take-home messages would be that the model of role play is really efficient because you put people poof, into the swimming pool and they just have to swim. And after the exercise, you see with all the people, okay, what was good, what went well, what was to be improved, and what should we do? And that for me, the most important point, what should we do? What do we have to do? Here, what was also interesting is that we came from little initiative to broader initiative, and on every level, there was new knowledge of people, new knowledge of networking, new knowledge of procedures. Also, other sectors were sensibilized like economic sector, army, etc. They told to us and said, "Oh, we didn't know that zoonotic infection could have this kind of consequences. So interesting to know." Network were consolidated. I have already said that. And also, what was sometimes said is that playing is sometimes more efficient than studying or trying to write down protocols, procedures, etc., etc. So we thank you very much.
Well, thank you very much, Geraldine and Jorgen, for this presentation. I also like very much the last take-home message that you have sent us, that playing is as useful as, yeah, writing protocol, studying. I have so many questions, and you know what? I think I will use my privileged role as host to ask you the first question, and then we would move to the audience. I mean, must have been really interesting to run this long simulation exercises. Really, I was wondering if you could comment, if you could tell us something on how was it really to work among the sector. I mean, you had the public health, you had the animal health, possibly even the wildlife, um, regarding the migratory bird. How was the communication working? How did you deal with working with different priorities to finding compromises and so on?
Actually, that was kind of challenge at first because some people involved in the network didn't know each other, especially animal sector. Actually, animal sector and wildlife sector do know themselves each other quite good because the NRL is collecting samples from wildlife and from animal, and the collaboration with the Federal Agency of Food Safety is actually really good. But there is this gap between public health, and it was more difficult to involve them. You know, this rivalry between veterinarians and physicians. Sometimes it lasts a little bit too much. In that case, the fact that the pathogen was zoonotic and that we would involve workers at rehabilitation centers, so people, real patients, but not farmers, I would say. This made the situation quite really operational because in one people, the three sectors were involved. And what we did to inject quite dynamics to saying, okay, this is not time for discussion. Now we need action. And actually, the people at the beginning were a bit shy to exchange. At the second exercise, they were more, fluent, more eager to participate. And at the third exercise, in the federal exercise, the connection was quite evident, quite good. And that was a nice point. I thought that the most important point was to put them into action. Not think too much, not discuss too much, but action. What should we do? Okay, let's go.
All right. Thank you very much. Anouk, maybe first I see that Jürgen, would you like to add something to this?
Yes, indeed. Yeah, I mean, I confirm what Geraldine is saying indeed. And I think each sector probably knows what to do quite well. So the veterinarians know what to do and the public health sector knows what to do, but they do not necessarily know what to do together, actually. And this is, I think, what we are trying to do now. And a second point, also confirming what Geraldine was saying, you can write plans and research projects, etc. But at one point you need to test them, I think. And that's really the added value, because just writing a plan is definitely not enough. And when doing exercises, you discover so many things, like you thought that you had covered this, but you discover that it's not the case. So I think it's really an essential component of preparedness, response, and even more One Health preparedness, because the different sectors involved. And I think also what helped is that in the beginning, like 3 years ago, the sectors did not really know each other very well. But now, because of these exercises, because of working together, we have this network now. People know each other, and I think it is really an added value that we have now. We know who to call, basically, in case something happens. And this is because of these exercises, partly.
And I guess you also have the One Health tools to interact, to use. All right, then I would ask Anouk if we have any comments or any hand raise or any question.
Yes, there are some comments in the chat. And the first one is, so the simulation exercises seem very appropriate and valuable approaches. Is there already specific evidence in real episodes where they have proven the expected value?
Actually, yes. I forgot to mention it. After what I call the prequel, there was actually a real crisis, and where actually the cats were involved, and also a market was involved. So that was wildlife. Everyone was involved, I would say, in that little crisis. That was in January until March 2025, and then all the people involved in the prequel CIMEX were put together in the same room and discussed on what to do. And it went very fluently, it went very smoothly. After that, we organized at Sciensano after action review to see what were the lessons learned, not from the CIMEX, but from the real life situation. And that was an enrichment of the action plan we did before. Really, really, thanks to the prequel CIMEX, people were ready to act together during the real crisis. And it's been going more and more better and better with the other exercises and the experiences.
Thank you. Any other question? I'm sure we have
there are
many.
several. I also have a question, but maybe I'll go to the chat first. So now you have a network for avian influenza, but what if the next pandemic is not avian influenza, but like a fungal parasite or a bacterial pathogen? Would it work in the same way, or?
That's a very nice question. That's really interesting. We already experienced other crises with food safety problems, with, you already know, maybe the Saheli problem, etc., etc. What is difficult here is sometimes these are not the same people who are involved because the subjects are different. And as we here for avian influenza, we get people know each other. In other diseases or the thematics, this is a bit more difficult to create this link. What would be, however, nice is that the central people still are quite the same. What we hope is that the example of the avian influenza network could be copy-paste to other type of diseases, vector-borne diseases, etc., etc., and make it as efficient as we try to do. And I'd say that for what is foodborne, this is going very well. no problem for that kind of outbreaks. For unexpected outbreaks like, yeah, vector-borne or disease X or something like that, still improvement to do.
Thank you. Yeah.
More questions in the chat if we have some time.
I think another couple of minutes we can take. Yeah.
So did you discuss also which kind of measures you would implement if you would find like a big dairy or sheep farm that's infected with high pathogenic avian influenza? And which kind of control measures you would apply?
Actually, that is an easy topic. The Federal Agency for the Control of the Food Chain is dealing with all animal health issues regarding the food producing animals, and all the procedures are quite running really well. They are really well trained. They know how to work. They know to deal with that kind of problem. And what would be implemented is what we already do for poultry. So that's confinement, quarantine, blockage, standstill, then cutting out of the infected animals, circle of 3 kilometers of protection zone, 10 kilometers of surveillance zone, etc., etc. So the measure already in place for poultry would be applied to other food-producing animals. What would be a new thing is that as this is a new reservoir, we would inform through the ZooWiz project, human workers would be involved in that kind of outbreaks. And this is already going quite well. In any outbreak we had in the poultry sector, ZooWiz was activated and the connection between the human and animal sector were going quite smooth. And for regarding question marks would still be there, the Zen network would gather together to discuss what should we do, who is the competence to who would act on that kind of point. We have a very nice example here is the question of domestic cats and even the stray cats, because the competence for that kind of animal is quite a bit blurry. And we are in discussion to try to consolidate the legal basis for that specific gray zone animal reservoir. So this is ongoing. This is also an ongoing work.
Thank you. Yeah.
Jorgen?
Yes, maybe to complete, indeed, I think the measures at the level of the veterinary animal sector are well known. What we have seen during the third exercise is when it comes to measures with a broader impact on society, should you, for example, impose mask wearing or whatever, then I think it will become more complex because this is beyond the animal sector, beyond the public health sector. And I think that will be one of the main challenges is measures that are broader than just focusing on animal or human sector. And there, I think that will be one of the challenges in case we have a future zoonotic big outbreak.
Thank you very much. I think we have time for one very, very quick question, and then we can move to the closing remarks. Anything in the chat?
Maybe we can finish it with a comment that DG Santé also organized a CIMEX on avian influenza in December 2024. Mentioned here.
Indeed, the simulation exercise of DG Santé, yes. All right, then at this point, I would like to thank Geraldine and Jorgen once again. And
Welcome.
I think we can try to bring together all the pieces of the puzzle before giving you the appointment to the next webinar. Let me just try to summarize. I think the presentation today demonstrated really the barriers that exist in the One Health research and in the application of then the One Health solutions across Europe, but also the barriers, but also some opportunities. Today we have followed a kind of a timeline, starting from the funding, then the research, and then the application of the developed solution. If we take the first step, so that of the finding of the funding, Well, my impression is that frequently the funding is kind of compartmentalized, especially at the national level. The funding pools are managed by different ministries. Often, although the issues are One Health, but there come different competences. And of course, we can do something at the national level. That's where usually the change takes place. But I think here is where the EU tool really come into our help and give us a hand. And Klein pointed out how we have two major EU funding programs that address One Health issues. We have Horizon Europe and we have EU for Health. EU for Health looks more at the preparedness, at the prevention. EU for Health is what really sets up the European One Health Union. But what the funding program that really deals with research, with innovation, is Horizon Europe. There are a number of partnerships within Horizon Europe that address One Health issues. We have seen some of them. However, I must say that they deal mostly either with the human sector or mostly with the animal sector. And in fact, they are indeed divided by Cluster 1 Health and Cluster 6 that deals with food, animal health, bioeconomy, and so on. Still, we have seen initiatives to bring together the sector under the partnerships, for example, Be Ready. And also we have seen initiatives that bring together different partnerships in a sort of bottom-up approach to One Health. There are indeed partnerships that organize themselves, that come together, that take a look at each other's research agenda. They try to avoid overlap. There are also, I mean, these are of course bottom-up initiatives. There are also initiatives from the European One Health Association. We also try to bring some partnerships together on certain One Health topics. Of course, this is good for the interactions. This is good for exchanging information, for the alignment. But at the end, we need to. We all have our own research agenda. We need to stick to our own research agenda, which makes things a little bit more challenging, I think. For the future, in the Framework Program 10, we have already seen that maybe we will have some opportunity to do One Health research, to have funding for One Health research, possibly on specific topics, but it would be great to bring all the relevant disciplines together, the human, the animal, the environmental side, and possibly even the social sciences. I think it would be also useful to bring different sectors together, the public sectors, of course, but also the private sectors, the NGO, and to set together the research agendas, considering the needs of the various stakeholders, considering their priorities. But now let's go back to the present and let's see the second step in our timeline, which is the research. We have seen the example of the partnership Be Ready and how they approach One Health, their One Health approach to certain issues. I was pleased to learn that in the second call of the translational projects, there are indeed the plans to bring together the animal health, the environmental health, even the social sciences, together with the public health side, to have this kind of integrated approach to pandemics, or at least encourage the different disciplines to join together a whole. Well, I think that an initial lesson from this partnership, possibly including Be Ready, is that the research on the preparedness, but especially I think on prevention, should be from the very beginning treated as the One Health issues. Then, if we work in this way, we can have meaningful, useful One Health tools that we can apply. And with the application, I would like to move to the third step of this timeline, which is really the application then of the One Health solutions. We have looked at the Belgium simulation exercise on avian influenza, which is a wonderful example of One Health solution put into practice. This is really an example of One Health collaboration that moves from the theory to the operational practice. And it shows really the impact of the One Health research solutions that are developed and put into operational practice. I understand that there were a number of barriers, the institutional barriers. Of course, we are dealing with institutions that have different mandates, different competences. Some of them have a regional competence, some have a national competence. The institute have also different foci. Yeah? Some are focused on the animal health, some of the human health, some of the environmental health. And I also like the solution, which was to create the network, the ZIN network. And by the way, I like very much all the names of your networks and of your initiatives. They sound very good as well as being so useful. I was also impressed by the surveillance exercise of the. I think this network was called ZOIS. I mean, it looks like something that was really harmonized between the animal, the farm, the farm animals, the human, and the wild animals. And this is really an example of One Health solution that then was applied in the field. And then also moving a step forward to this risk analysis. So moving again from the field to the policy advice. And I think here in the future, we would need more training on how to do this step. So we have talked about the need of having a little more training on the return of investment, on the cost benefits, and also in general, how to move smoother from the One Health solutions to the One Health decisions, to the policy decisions, which is really then the final impact of our One Health research. We start from the research, we reach the policy. All right, all this lesson learned will be part of our joint statement. So please feel encouraged to join Peitho in our thematic network. You will find a virtual space where you can also really co-write our joint statement. It's there, open for you, open for your input. At this moment, we reached 12:30, so I would like to thank very much once again the speakers, the colleagues of the platform, the attendees, and I would like to give you the appointment to our to our third webinar, the 10th of July. This will be on One Health operationalization and governance. We will welcome the colleagues of the cross-agency One Health Task Force. As you know, this is the alliance of the EU agencies. And if you have indicated on the form, on the registration form, that you would like to be contacted, you will receive a reminder email. Otherwise, on the platform, you will have the registration. Well, thank you very much again, and I wish you a very good afternoon. See you on the 10th of June.